Hi there, welcome to another segment for Diet-Wise Academy. And I'm going to talk to you about FPES, or FPIES as some people say. What does that mean? Food Protein Induced Enterocolitis Syndrome. So I suppose FPIES is maybe a little bit of a pun. It's to do with food. Well, the history of this goes back for me over 3 decades. They said there was no such condition, there couldn't be such a condition, could never happen. We told them, I wrote it in my books, and other doctors in this field published books. We told them over and over, they just wouldn't listen. All nonsense, they said, all fraud. 30 years on, they've decided that we were right. And of course we were right all along. They were saying food allergy as a whole was all a hoax. You know, you couldn't be allergic to food in the way we said. The only kind of food allergy they would allow or recognize were these severe reactions where there's an antigen-antibody response, an IgE response. I won't get technical with that, but let's just say it's the antigen-antibody type of thing. The very typical thing, that's an allergy, will allow you to say that, but it never happens with food, or hardly ever. So it's very rare. And then gradually they've come around to realizing that they were wrong, in fact. The whole thing about this syndrome, I want to talk to you the whole segment now about food protein induced enterocolitis syndrome. And the whole point about it is that it's inflammation of the small intestine and the colon due to food, where it's categoric that there is not an antigen-antibody response. It's not IgE mediated. In fact, it's cell mediated. So having admitted that, they actually threw away the stuff of all those attacks all of those years. You know, they said it couldn't happen. Now they're saying, well, it could happen. Of course, nobody's going to go back and try and rewrite history and say, oh, sorry, we shouldn't have been rude about it. I think there's a couple of lessons to be learned. The first one, a bit tongue-in-cheek, but the idea they attack on holistic pioneers is very misguided. Often people in my position were willing to look at things in a different way, and in our clinical perspective we'd see things that were not in the textbooks. But we were smart and we listened to the patients and we observed for ourselves with our own eyes and our own ears, touched things with our own hands, and we learned lots of things that were definitely not in the medical textbooks. Do you think that means we were hallucinating or stupid? Of course not. It means the textbooks were inadequate and incomplete. Listen, try and tell that to a scientific doctor. There were these reactions. We found reactions quite categorically that definitely existed, but for which there was not necessarily an explanation. We didn't know why. But listen, I tend to believe mamas, if they come in with their kiddie and say, every time I feed the kiddie this food, she gets or he gets terrible diarrhea, I'm not going to say, you stupid woman, that's not possible. I'm going to be very interested and say, do any other kinds of foods do it? Does it always do it? Or only sometimes? How much of the food does it take to stimulate this reaction in the child? What else do you see? What other symptoms does this kiddie get apart from the diarrhea? That's how I learned my medicine. I learned all the good medicine that way, listening to what patients tell me. And I believe that mamas know a lot more than doctors. They're right 99% of the time. They're very good observers of their own children. Okay, so what is this FPES thing? Well, it's, as I said, it's inflammation or disturbance of the intestinal tract, particularly lower down, but not necessarily all the way down. Usually there's an onset within a short time of food. I mean, duh, how simple is that? You know, the kiddie eats the food and something goes wrong. That's the first thing I'd think of, is a food. But for doctors, they don't have that perspective. They come up with ideas like stomach flu. Now, there's no such thing as stomach flu. But you see, when I hear a story like somebody eats a food, there's a symptom, I think immediately of food allergy. I think first of food allergy, I think last food allergy, and most of the thinking in the middle, I think food allergy. Whereas when something strange happens, most doctors just grab at the virus idea. You know, they don't do any tests for virus. They don't know it's a virus. They just say it is and pat mama on the back and send her home. Oh, it's just a virus. It's a stomach flu. It will clear up. And of course, they're sometimes wrong, and it can be severe and fatally wrong. This can be a very serious condition to a little child. And I had many a kiddie, going back over 30 years, who was really sick, you know, almost sick to death's door, and the doctors had kind of given up on the kid. One or two, they'd virtually been sent home to die. Fortunately, the parents found me, and we found it was just the food. we put it right, and the child made a, like 100% recovery, because it's simple to treat this. If a food does it, don't eat the food, the symptoms go away. I mean, how difficult is that? The main symptoms are diarrhea and vomiting. You'd expect that. What the body is saying is, we don't like this. It's inflammatory, it hurts us, it's toxic, and we'll throw out the food at both ends. And the vomiting can be really severe, like the child will really go, we call it projectile vomiting. It shoots several feet across the room onto granddad's lap sometimes. Well, you'll understand from diarrhea and vomiting, especially if it's severe, then the danger becomes dehydration, and the child may drop very limp and very, lost far too much fluid. It can even go as far as shock, and it becomes an ER job. The child has to be rushed to hospital. On the longer term thing, these are the acute episodes. On the longer term, the child will often exhibit a failure to thrive. That's a medical term, meaning doesn't gain weight normally. The average weight of children goes up like this, and our child doesn't come up at that speed at all. They're falling behind. They're not gaining weight as they should. Well, that's logical if diarrhea and vomiting are throwing food out. This is a case where the main target organ is the intestinal tract. You'll hear me teaching, of course, over and over. There can be many target organs for these food reactions, but at least the orthodox doctors have woken up to the fact that this much is happening. What kind of foods? Well, the rule is any food can do it. Absolutely any food can cause any symptom in any person at any time. That could be my motto for my over 30 years of medical practice, and I found it to be invariably true. However, some things are commoner than others. And it's true, the orthodox doctors have noticed that what they call the first foods are often the offenders. The main reason is because that's where the kiddie starts, and so you're going to hit the trouble pretty early on with these foods. And the classic one is milk, of course, but soy, because that's used as a substitute and is in a lot of children's formulas. And baby cereal mixes. Cereal foods are not natural to us. I don't care even if it's whole grain. These are not natural to human beings, and they're pretty toxic family. If you want to get well, stay well, live long, feel good, just give up grains, because they don't belong in our diet. We're supposed to be hunter-gatherers, okay? Anyway, outside that range of what they call first foods, other things show up, like rice, oats, barley. Those are grains, of course. You'll spot that quickly. Peas and beans, sweet potatoes, and sort of oddball things like squash, chicken, and turkey. Why? Maybe because, we tend to eat more of those than other foods. But as I said, you must hang on very firmly to the fact that absolutely any food can do it. A child can even react to food via the mother's breast milk. So something the mother's eaten will appear in the breast milk, sometimes in sufficient quantity to make the child sick. Doctors like me, we were noticing this 30-odd years ago, but modern doctors are now pretty hip to this too, and it's not surprising. Whatever's circulating in mama's blood will pretty soon be in mama's milk, which is only a modification of the blood plasma. As I said, any food can do it, so nothing can be excluded. You can't say that couldn't do it, so we'll ignore that. The basic treatment, of course, is about as simple as it gets. You detect and avoid the foods, and this is what we do so well in Diet-Wise Academy. It's all about identifying and eliminating inflammatory foods, stress foods, intolerance foods, allergy foods, doesn't matter what you call them, foods that make trouble for that person. Okay, well, testing is simple. You avoid the foods, you see the symptoms improve, you do a challenge test, and you see that the symptom will tend to recur when the food reappears. You've got to be careful, though, with kiddies. If they're very small, remember their body weight is small compared to us, their total amount of body fluid is small, so they can't afford so much leeway as we can. So you should test with very much smaller portions. You need to be patient and be prepared for the fact that symptoms may not happen for the first day, or even the first 2 or 3 days, or even the first week. But I'm pleased to say, if you do it right, the way I teach in Diet-Wise Academy, you will usually see the result within a few hours. And it can be pretty clear. You have to just do the test in the proper way, the way I teach. Orthodox doctors who like fancy tests, they're trying to adapt the ATP patch test. That's where you stick a patch with the allergen in it on the person's skin and see what happens. But they're chasing their own tail here because this is not an atopic condition. Atopy is the classic IgE, antigen-antibody reaction. So they're trying to use that test for something that they've already admitted doesn't have that mechanism. Don't see much future in that. But look, you can do your own application test. It's really simple, and I've described this elsewhere. You just take a fruit or vegetable, a piece of the food, just tape it to the forearm. Look, I've done a pretty ugly graphic here. But that's all you need to do. This is a sweet potato chopped off on the open side in contact with the skin, a coil of sellotape around the arm just to keep it in place for at least a few hours, 24 hours if you can. But the thing is to keep checking. You know, the reactions can be severe. And if sweet potato on the skin produces a very severe inflammatory reaction, then you wouldn't want to give the kiddie that food, would you? I mean, come on, it's very simple. There are other fancy names you might bump into. This is orthodoxy at its worst. You know, they like fancy labels. They can't bring themselves to say this child is sensitive to milk and it upsets the gut. That's English. So they call it MPs, that milk-induced enterocolitis syndrome. With soy and milk, it's MSPs, milk and soy protein-induced. It's all a waste of time. It's just MPs, right? Sorry, FPs, due to different agents. Food protein-induced enterocolitis. That's all you need to know. But there's an important bigger picture emerging here, and I'm very glad about this. What's happening is that gradually orthodoxy is realizing more and more things can make a person sick, with or without a known mechanism. A person can be allergic to a food or intolerant of a food, even if you can't say why. You know, there's no obvious mechanism, there's no antibody. These are what we call cell-mediated responses, meaning the tissues themselves react without necessarily being prompted and teed up by antibodies. So they're getting outside of the old classic view of, you know, food allergy is very rare. It affects at the most 4 foods, you know, milk, fish, nuts and eggs. Those are the only things they ever recognized. And those can be pretty extreme. So they'd have to be pretty idiotic and stupid not to see those. You know, sometimes the person is fatally reacts to those foods. It can be very severe. But also gradually they're coming to realize more and more target organs. You know, the idea that allergy can only affect the skin with eczema or hives, or only affect the lungs, they get asthma, or rhinitis, you know, when a person gets catarrh and sneezing. They're beginning to realize that reactions can go outside of this classic group of organs. Of course, we've been saying it for years. I've been teaching the whole panoply of target organs for a lot more than 30 years, in fact, getting on for 40 years. Because if you take the trouble to listen to the patient, to look, listen and observe and not get stuck down in medical dogma, you'll very quickly realize how common it is. And that's why I set up the DietWise Academy, actually. It's to help folks learn what to do and learn how to manage their lives. If you take the trouble to do this, your health will improve immeasurably, your energy, vitality will come on stream, you'll have that kind of sparkling, bright mental attitude, feel 10, 15 years younger and probably live 10, 15 years longer. I think we're winning. I think we're getting through to the orthodox doctors that what you eat can be of crucial importance, not just what you might be lacking, but eating things that are doing you harm. Okay, thanks very much for listening to this segment. Take care.